Today's health headlines: are policies to lower insulin costs helping? How accessible are GLP-1s to patients right now? And what will the White House's new deal with Novo and Lilly mean for people with obesity? Joining us this morning, Dr. Kasia Lipska, Yale Medicine endocrinologist and associate professor at Yale School of Medicine. Doctor, thanks for being with us. In a study published just this week, you investigated how the cost of insulin limits access for patients. Now, there have been several policies over the past few years aimed at lowering costs. The question is, are any of them really helping out in any way?
Well, we were disappointed, but no, not really, and not enough. In our new study, we found that even after all these laws were passed to make insulin cheaper, the number of people rationing it hasn't changed. About 1 in 4 patients at the Yale Diabetes Center told us they take less insulin or skip doses to make it last longer, and that can be very dangerous. We saw the same rate 7 years ago in our earlier study. So the $35 cap helps Medicare patients, but most younger adults don't qualify, and many still pay more than they can manage. Look, I still see this in clinic. People are making really hard choices just to afford the insulin that keeps them alive.
Doctor, let's talk about these GLP drugs for obesity. They certainly are very, very expensive, and they're out of reach for many patients. Can anything be done about that?
Yes, affordability is major issue with these drugs. A recent study led by my colleague, Dr. Alyssa Chen, we looked at national data collected even before the new GLP drugs became widely used, and we found that people with obesity were significantly more likely to ration their medications because of cost. And it may sound like a small percentage, about 8%, but that means millions of adults nationwide. And those data came before the use of drugs like Wegovy and Zepbound were widespread. They currently cost over $1,000 a month, and most insurance plans still don't cover them for obesity. So the problems we documented are certainly greater today. Lower prices and more coverage could really make a difference.
Doctor, the White House just announced a deal with the CEOs of Novo and Eli Lilly. What does that mean for people dealing with obesity?
Yeah, so this is a big deal. The White House deal with Eli Lilly and Novo Nordisk will lower the prices of drugs like Wegovy and Zepbound for Medicare to about $245 a month, with about a $50 copay for Medicare beneficiaries, and also make them available directly to consumers for roughly $350 a month to start off with. It's real progress since these drugs are highly effective, but there's still a lot we don't know: which Medicare's plans will cover them, how states will handle Medicaid, and when these prices will kick in exactly. And look, while the administration calls this a win for patients, it's also a big win for pharma. The companies got tariff exemptions and a massive new customer base just as they roll out the next generation of weight loss drugs.
All right, Dr. Lipska, thank you very much for your time this morning. Some great information. We appreciate you.